So first of all, I would like to thank the organizers for introducing this specific session on community education because this has been underestimated before, but this is a critical area that we all should be doing or focusing in addition to our lab work. And I'm going to present the work that we've been doing in Tamil Nadu, specifically in India for the last 3 years, mainly to improve awareness, education, and management. My talk has been somehow simplified by the previous talk by Anika and also Beth and Jnaneshwar. So I'm going to really focus on the specific activities that we've been doing in the last few years. So we all know that snakebite is a big problem. It's affecting mainly rural communities, specifically India, which is being considered as the capital of snakebites. And there's quite a lot of perception and myths about snakebites in rural communities. And I don't know really how to bring these people out of these myths and perception, despite they are being well educated. And there's quite a lot of influence of traditional medicine. But to be honest, over the recent year, this is going down, which is really good. But on the other hand, people are still obsessed with inappropriate first aids. Again, that's something we need to really break it down in order to bring people out of these inappropriate first aid methods. We keep asking people to go to hospital very quickly, seek prompt treatment. But in the reality, there are so many villages suffering without road facilities or nearby medical facilities. So they are really struggling. People are happy to go to hospital, but they need to travel 4 to 6 hours, in some cases, even 8 hours to reach a hospital. And the Tamil Nadu government specifically introduced these primary health centers in most of the villages, at least within like 25-kilometer radius, there should be one primary health center. But the problem is the lack of expertise and lack of facilities in order to treat snake bites in the local setting is being a big problem. And also, as always, there's been a limited attention from healthcare authorities because they do have their own priorities. For example, COVID, which has taken over the entire world for the last 2 years. So automatically snakebite will go to bottom of their list. But we are trying our level best to bring some attention within Tamil Nadu, at least to focus on awareness, education, and management things. So collectively, all these factors are leading to snakebite-induced deaths, disabilities, and significant socio-economic ramification. One important aspect here is the lack of reliable data. The first paper was published by Mohapatra et al. They said it's around 46,000 deaths in India. The same group recently published a paper, it's around 58,000 deaths. So that's sort of like a reasonable estimate that we can get so far. But in reality, there are much more higher number of incidents and deaths happening within Tamil Nadu and across India than what's being reported. And because there's no reliable statistics or data, the burden of snakebite on rural communities has been underestimated for a long time. So we did a study back in 2010 to determine the actual number, at least to get a vague idea of how many snakebites are happening in rural settings within Tamil Nadu. And by interviewing snakebite victims, we interviewed around 125 victims personally to determine the socio-economic ramification that snakebites are causing on these people or their families or within their society. So in this paper, we reported the snakebite numbers, the incidents and deaths could be much higher than what's been previously reported by the government and other authorities. And there's a huge lack of awareness. So around the world, if you ask anyone who is more than like 5 years old, if you ask anyone about snakes and snake bites, they will say something about snakes and snake bites. But the moment you go beyond that and ask a little bit more in-depth questions, they will struggle. For example, the difference between venomous snakes and non-venomous snakes, what to do, what not to do. So this is the case even in Tamil Nadu. The lack of public awareness is a huge problem. And people highlighted the distance they need to travel to hospitals is huge in some places. So they are spending a lot of time on travel. And because of this, they are getting delayed hospital treatment despite we force them to get prompt hospital treatment. All of these are exacerbating the complications. And because of the exacerbated complication, the cost of the treatment will be substantially high. Even though the government hospitals are providing free treatments in India, particularly in Tamil Nadu, most people prefer to go to private hospitals due to several reasons. And most of these people, particularly in rural villages, including my own parents in olden days, they don't have any health insurance. So a single snake bite or a single major illness can change their life completely upside down. So this is what we found out. The next thing, we interviewed 25 clinicians who have been treating snake bites for a long time to understand their views on challenges they are facing to diagnose and treat snake bites. Again, here, the clinicians emphasized that not everyone is confident in treating snake bites. This is what Anika has mentioned now as well. There are only limited, well-experienced clinicians, and they are available only in limited locations. So people traveling long time in order to reach these hospitals or reach these clinicians to get a prompt treatment. And despite the WHO protocols available, national protocols available, state-wise protocol available, most of these clinicians don't even care about these protocols. These well-experienced clinicians, they are only relying on their experience. The remaining people, they are not even aware of this protocol. And they also emphasize that the delay in seeking treatment is a critical factor. And that's what is leading to substantial treatment cost because of the surgery and other treatments that they need to provide as well. And in some cases, they are struggling to get enough antivenom supply. As many people have highlighted in this conference, there are only certain companies providing high quality antivenoms. At least they work really very well for Tamil Nadu, because that's where the venom is being collected from big four snakes for antivenom production. But still, sometimes there's a crisis for antivenom, so they do struggle to get antivenom. And the other thing, again, as Anika has highlighted, lack of awareness about among healthcare professionals is a big factor, particularly rural healthcare professionals. They don't know much about snake bites, and they don't have a confidence to handle snake bite victims within the rural settings. So this is a big problem. So back in 2018, we launched a mega snake bite public awareness campaign in Tamil Nadu with 3 key aims. First one, to improve awareness, not only among public members, it's mainly for healthcare professionals too. The second thing, we need to improve education, as Anika has highlighted and Jordan has highlighted. We need to improve the education. So students in schools, particularly secondary schools, higher secondary schools, and colleges and universities, they do study about lots of different diseases. So they can also study about snakebite, because snakebite is a really good model to cuts across multiple disciplines like cardiotoxicity, myotoxicity, neurotoxicity. So this can be introduced into their curriculum. So people can start to learn about snake bites from their earlyhood, like at least from 10 years old, they can start to learn something about this. On the other hand, we have snake venoms. The venoms are really powerful biotreasures, and that can be employed easily in several disciplines. For example, biochemistry to understand the enzymes and non-enzymatic functions, microbiology, and so many other areas. So we are trying to include both snake bite and venom into school and college curriculum too. So that's another key aim here. Final thing is to improve clinical management, particularly among rural healthcare professionals, because that's what is going to provide immediate treatment for patients. Whatever we develop in future, whether it's a small molecule inhibitors or recombinant antivenoms, if people don't come to hospital, we will be in trouble. So it's really important for these people to come to hospital. But when they are ready to come to hospital, we should be ready to provide the treatment that they need within the local setting, rather than making them to travel such a long time. So this study has been specifically rolled out in Tamil Nadu. And Tamil Nadu is a large state. It's got like 77 million people, particularly 35 million people are living in rural areas. And we aim to reach around 10% of this rural population. And for this type of activities, we can't just give lectures, because people will listen and then completely forget after 1 or 2 days. So it's really important to develop specific impactful campaign tools, and that's what we aimed in this study. And we have to use multifaceted approach. Directly, you can't go and meet all 77 million people. That will take at least 20 years. And then we had to use the media, because media is being vigorously active these days, so we can use them for this type of activities. And the social media is really important, particularly in Tamil Nadu. Nearly 18 million people are using just Facebook. So it's really important to use this resource for this type of activities. Then the next thing, we had to focus on the measuring the impact activities. Whatever we do, people will listen, and at the end of the day, if it's not changing anything, then we are wasting our time. So we put a lot of effort into how to measure the impact activities. Then we developed one symposium for healthcare professionals, particularly for rural people, and then an online survey that Anika has emphasized in the previous talk. So we developed a snakebite information leaflet. As you can see here, this is the leaflet in A4 size, both the page printed in a high quality printing. So it had like lots of key information about big four snakes and their clinical symptoms and what people should be doing and not doing when somebody is bitten by snakes. So far we distributed 300,000 leaflets among Tamil Nadu rural population, and we are still continuing to do this. Next, we printed lots of information posters, both in English and in Tamil. And this has got key information about big four snakes again, and their clinical symptoms and what to do, how to avoid snake bites. This has been stuck in multiple public places, including hospitals, health centers, small health centers in villages, and the police, forest offices, and we are continuing to do more of this as well. And then incredibly, using Health Action International poster on snakebite first aid, we translated this for Tamil because this poster is exceptionally catchy for rural people because they can just look at the picture and they can understand what they are supposed to do when somebody is bitten by a snake or not. So this poster is being vigorously disseminated at the moment. And we are in discussion with the Tamil Nadu government to see whether we can stick this poster in the entire, I think around 1,450 primary health centers at the moment across the state. So that's also going on. And then we developed lots of video documentaries, both short and long documentaries. The long documentaries means around 30 minutes, and short documentaries 3 to 5 minutes with key information about snake bites. We developed a dedicated Facebook page for this campaign because, as I said, nearly 18 million people are using Facebook within Tamil Nadu. And Facebook has got really good opportunity for us to do some adverts. You can develop a small video and then you can pay some money to make this as a targeted video specifically for people in the target location. So that's also really incredible. And this is where we spent a lot of time to develop a pictorial questionnaire, again, using Health Action International poster in order to measure the impacts of our activities before and after our activities to capture the knowledge of people and the students in schools and colleges. And then the massive working team is really important for this type of work. Initially, we started with around 10 people. Now we have nearly 150 people working for this project in Tamil Nadu. So it's really, really important. It's a massive teamwork. So we got lots of hospitals, NGOs, snake rescuers on board. And that's why it's been really successful. So we ran lots of assemblies in local villages, but mainly in public places and schools and colleges. So where we gave like a small lecture and then played video documentaries and distributed information leaflets and answered lots and lots of questions from people and the students about snakes and the snake bites to break the myths or the perceptions around snake bites. And using traditional media, we published over 100 articles. I think now we published around 200 articles, both within Tamil Nadu and also across India. So this has been very, very helpful. And in Facebook, we got over 20,000 followers. And that's where we were disseminating all our materials, activities, and media articles. And we also used Facebook promotion for specific ads to target specific population in Tamil Nadu. So within Tamil Nadu, we covered multiple villages, like over 100 villages, over 150 institutions. Overall, we reached nearly 250,000 people directly and nearly 3 million people via social media, particularly Facebook. And using media, traditional media, we reached over 70 million people. And then we ran a symposium specifically for healthcare professionals. So that received nearly 250 rural healthcare workers. And we covered a range of different topics and we identified the training needs in addition to what we are identifying now using the online survey. It sort of created a positive impact for these people. Again, we created a massive network using all these activities. So this is how we measured the knowledge before our activities and after our activities. So definitely our activities have increased knowledge among students and also rural people. And then we also measured the treatment seeking behavior in one particular hospital. That's a referral hospital called the TCR Hospital in Krishnagiri. And we seen clearly the difference in treatment-seeking behavior among people, at least in this one hospital in Tamil Nadu. So people are starting to come to hospital within 4 hours compared to before up to like 48 hours. And many people are coming to hospital without applying any inappropriate first aid. So that's sort of like a remarkable achievement of these activities. And then in order to promote education, we ran separate workshops with people who are teaching medical courses and people who are teaching life science programs, people who are teaching other professional courses, for example, law, veterinary science, Siddha, Ayurveda, agriculture. And we identified several points here that except in few curriculums, except in few modules or courses, no one is studying anything about snake bites and venoms. And many clinicians, they don't even have training on snakebite management. So we analyzed all the curriculums from different universities and different colleges, and we identified all the gaps. Now we are working together with multiple teams in order to develop new curriculums already for this academic year. It's already started in India. So in 4 or 5 colleges, we introduced snake bites and venoms, for example, in social science work and agriculture, critical care technology, we introduced snake bites. And we are planning to roll out this education in multiple places. And finally, we had one workshop with the snake rescuers and NGOs, because most of the time these people are being neglected and these people are giving up their lives to save snakes and save other people's life. It's really, really important to understand the needs of these people. So we spent one full day to discuss with over 150 snake rescuers and NGO people to find out exactly what are their issues for safety and what are the challenges they are facing when they are rescuing snakes and when they are disseminating snakebite awareness activities and their expectations from government. And we identify their training needs and the materials that they need in order to protect themselves and to protect others as well. And most importantly, these people are acting as our local champions. And that's what everyone should be using. There are, compared to like 10 years before, we do have lots of snake rescuers, lots of people passionate about conserving snakes and passionate about snake bites and passionate about improving awareness. So we can use these people for the awareness activities and other activities, and they can be very good local champions. And they need some form of recognition for their work as well. And then eventually we managed to arrange one symposium with the government officials, particularly from Ministry of Health. We managed to get the Principal Secretary from Ministry of Health of Tamil Nadu, and we emphasized various factors and we discussed various factors specifically with the policymakers. And we emphasized here the need for SPE statistics. As I said, this has been hugely underestimated always. Now we are thinking how to capture SPE statistics specifically from private sectors, because the government has never ever collected any statistics from private sectors, and the private sectors never maintain any statistics. So we are thinking to find out the ways to do this. And then the health insurance. Tamil Nadu has got a Chief Minister comprehensive health insurance scheme, and they are providing up to around 300 pounds for snakebite treatment, but that's not enough in multiple cases. So we are trying to see whether that can be increased and that can be rolled out for multiple people. And we are also speaking to some private health insurance people as well to see whether we can introduce specific insurance schemes for snake bites. And we are also asking the government to do lots of awareness activities in cinema theaters, televisions, because it will be much better when it comes from the government than it's going from us. And then the policy guidelines, the government is looking into revising the guidelines, and the government is happy to roll out the curriculum in multiple colleges, universities, and school education as well. And the government has asked us to form a Tamil Nadu Snakebite Consortium together to work with the specific people in government of Tamil Nadu at a higher level. So we are in the development of this consortium at the moment. And the government, and as we want to develop Tamil Nadu as a model to substantially reduce snakebite-induced deaths and disabilities, as WHO set their goal by 2030. So this model can be adapted for other states of India and also for other countries. So in summary, the low-cost community health education is really effective, but the only thing is it's extremely time-consuming. So without a massive team of work, this is not possible. And the multifaceted approaches, as Beth was explaining, this is clearly working, and that's what I think we should be doing it. By repeatedly providing the same message again and again to people, we can definitely implant the key information in their mind and which they will never ever forget. And the breaking myths, it's possible, it's doable, but it will take some time. And as Anika has emphasized, health is important. Most people in India are using mobile phones, particularly smartphones, and they do have internet. So we should be able to achieve quite a lot of things via mobile health and develop lots of information tools and training tools. And by providing more confidence for rural healthcare professionals and repeated training for them, we should be able to provide prompt treatment for snakebite victim. As I said before, these people are ready to go to hospital if the hospital facilities are available in the nearby area rather than traveling for a long time. Then slowly our work will lead into revising the policies very soon within Tamil Nadu and then slowly across India. So I would like to thank all the collaborators because this is a huge teamwork. As you can see, lots of NGOs, companies, and the hospitals and the multiple people are involved. And I would like to thank many people who are sitting in this conference as well, because many of these people are directly and indirectly supporting this work for the last 3 years. Thank you so much for your attention.